Hello, everybody. Welcome to my channel. I'm Jeff Olson, and it's been a while since I've done a video. And kind of a busy month. Summer's always busy in Utah, where I live. But today, I wanted to talk about this situation. It's a status called anosognosia. It's come up recently with me and my daughter and some other people that I've been helping. Before we get rolling on this, though, I'd like to remind you, please subscribe, like, send me comments. I don't get very many. Hopefully, this is helping you. If it is, please let me know so I can keep doing it. Um, but today, I want to talk about this situation that comes up frequently with caregivers where your loved one may be refusing treatment, may be refusing help, medication, whatever, because they genuinely don't believe that they're mentally ill. And there's actually a term for that. It's not just denial, and we'll talk about the difference between denial and anosognosia, but anosognosia is a neurological condition, and we're going to talk a little bit about that. So again, welcome to the channel. Hopefully you've had a chance to look at some of my other videos. Again, like and subscribe. So let's get rolling. And as many of you that have watched the channel for a little while know, I actually run a nonprofit called Deep River Mental Health. We are a fundraising entity that raises money for those who cannot afford mental health care. And if you go to that URL that's right above my head, right there, there's a place that you can donate and you can apply for help. I am located in Utah, but it really, we serve the entire country. So please take some time and do that. Like and subscribe. Like I said, that's what keeps me motivated to continue sharing and helping. So this idea of anosognosia. So sometimes, you may have asked yourself, or heard yourself saying about your loved one, why can't they see that they're sick? We always look at people with our, quote unquote, normal outlook and point of view, and we look at them and say, well, can't you see that you're sick? Can't you understand this? Why won't they take their medication? Why do they keep insisting that nothing is wrong? If you have a loved one like I do who is suffering from schizophrenia, schizoaffective disorder, bipolar, anxiety, other serious mental illnesses, you've probably asked these kinds of questions more than once. And it's frustrating. It really is, because we see it, but they don't, or they don't seem to see it. And so we automatically think, oh, they're just in denial. Let's explore that a little bit. Now, if you're like most caregivers, you've probably become, like me, frustrated, exhausted, and perhaps even a little bit angry. It's okay. Because from your perspective, the signs seem obvious. It's obvious to you. It should be obvious to them. Can't they see it, right? The hospitalizations happened. Didn't you see yourself in the hospital? The delusions were happening. The medication helped. So why do they keep saying that they're not sick? Well, there's a number of reasons, and we're going to talk about that. So I want to talk today about one of the most misunderstood symptoms of serious mental illness, and it's a condition, as I said, referred to as anosognosia. Some of you may have heard this before. Some of you may not have known that the word existed, but it truly is a term that is familiar to a lot of psychologists, a lot of those in the mental health space. So understanding anosognosia may completely change the way you view your loved one's behavior, and I hope this does help. So what is anosognosia? Well, anosognosia, by definition, is a symptom, a neurological symptom, that prevents a person from recognizing that they have an illness, in this case, a mental illness. Let me say that again. It's a neurological symptom that prevents a person from recognizing that they have an illness. Not making it up. and it's not denial. We'll talk about that, right? It truly is a neurological symptom. So because of this, um, um, we tend to think that they're lying, that they're making this up, but it's a neurological symptom because it's not because they're lying. It's not because they're stubborn. It's not because they're trying to make your life difficult, even though a lot of times it seems that way, but because the illness itself, and again, it's an illness, affects the brain's ability to recognize that the illness even exists. Now, think about that for a minute. The very organ that is sick, the brain, is also the organ responsible for recognizing the illness. Kind of strange, isn't it? It's like asking a broken ruler to measure itself. Now, when somebody has anosognosia, they may genuinely believe that they don't have schizophrenia or anxiety or whatever the case may be. They may genuinely believe that they do not need medication. Why are you putting those pills in my mouth? I don't need them. Okay. They may genuinely believe that the doctors are wrong. And that's what makes this symptom so difficult for families and caregivers to understand. It makes total sense to us, but it doesn't to them. Now, one of the biggest mistakes, as I've mentioned already, that a lot of families and caregivers make is confusing anosognosia with denial. And in this chart I have on the slide, we compare some of, not, it's not all inclusive, but some of the differences between the two. Now, denial does exist, okay? We've all seen it. We've all seen people in denial of certain things. Someone knows they have a problem, but they don't want to admit it. Alcoholics, people who smoke, people who take drugs, all of those things, right? They know they have a problem, but they don't want to admit it. Okay. That is denial. Someone knows they have a problem, right? Now, the person can acknowledge the facts if they're pushed hard enough, if they're in denial. I may deny the fact that I'm an alcoholic, but I can present you with the facts, the empty beer cans in your car, uh, the constant hangovers, whatever, and you can't deny those, right? That they acknowledge that there are contributing factors to whatever it is they're dealing with. That's denial. Anosognosia is different. With denial, the person can usually acknowledge the facts. Like I said, if they're pushed hard enough. With anosognosia, the brain isn't accurately processing these facts in the first place. Like I said, the very organ that is having the problem is responsible for realizing that there's a problem. And in anosognosia, it's not accurately processing the data. Okay. This isn't somebody refusing to see reality. Okay. This is someone whose ability to recognize reality has been impaired by illness. Okay. So hopefully you can see the difference. Denial is more of a intentional thing that I'm denying because I don't want to face it. Anosognosia is not intentional. It is an actual illness. And so hopefully, like I said, you can see the difference. And so there is a huge difference between the two. And that is why arguing often gets us nowhere. And what I mean is looking at your loved one and saying, well, of course you're sick. Take the medication. When you take it, it works. But in their mind, they don't, it doesn't, they don't see it that way. Okay. So it's a real illness. It's a real situation and something that we need to learn how to deal with. And caregivers definitely get frustrated over this because our knee-jerk reaction is to argue. Okay. So caregivers get super frustrated over this because as a caregiver, you have to sit and watch them suffer. Okay. You watch them lose relationships. You watch them struggle to have a job, to maintain a job or to do any kind of work. You watch them get hospitalized time and time again. I've seen it so many times. And then they look you straight in the eye and say, there's nothing wrong with me. So frustrating. So it feels impossible. It feels impossible. You want to shake them. You want to grab them and say, how can you not see it? How can you not see what I see? Right. But here's the hard truth behind that. They may truly not see it, not because they don't care and not because they don't love you or believe you, but and also not because they're intentionally trying to hurt you, but because their illness may be preventing them from recognizing what's happening. For many caregivers, understanding that fact changes everything. If you understand that they truly cannot control it, and it's not intentional, it changes the way you communicate with them. So arguing, which is, like I said, kind of our knee-jerk reaction, doesn't always work. Why don't arguments work? Well, some of you may have already figured this out, but many of us, myself included, as I told you, I have a daughter, 38 years old, who's suffered from schizoaffective for 14 years. And I've been the gauntlet from arguing to empathy to everything in between. But many of us spend years trying to convince our loved ones that they are sick. We point to hospital records. We remind them about psychotic episodes. We talk about what happened during previous crises. We present facts, evidence, logic, and yet nothing changes. Why is that? I know with my daughter, after her psychotic episodes, God love her, she forgets. And I will look at her and say, do you even remember? Do you remember being in the hospital? Do you remember that time you went in the backyard in your bathrobe and were screaming at the bushes? I mean, and they don't, and that's what's so frustrating about it is nothing changes. We present logic, we present evidence, we present records, and it doesn't change. So why doesn't it change? Well, it doesn't change because we're trying to solve a neurological problem with an argument. Now imagine trying to convince a person with a broken leg that they should just stop limping or walk normally, right? They may want to, but they physically won't be able to do it. No matter how logical your argument is, the injury still exists. Similarly, when insight is impaired, facts alone aren't enough. In fact, constant arguments can do more damage to trust and make the situation even worse. Some of you are probably nodding your head going, yeah, I've tried arguing about it. I've tried showing them evidence and it just makes it even worse. Okay. So let's talk about what your loved one may be experiencing. Now, imagine, before we get into the leap, I want to go back here. Imagine hearing voices that sound completely real. Imagine feeling that certain people are always watching you. Imagine believing your thoughts are accurate and reasonable. My daughter, I've told this story before. My daughter, again, suffering from schizoaffective, sat at our dinner table for years, insisting that there was a German prince sitting in the seat next to her and he needed to have dinner. And she was fully convinced that he was there. They were completely real. And she felt like her thoughts were reasonable and they were accurate. Now imagine being in her position, that this was real. She saw him, she heard him, she experienced him, he was watching her. And now imagine everybody around you saying, that's not real, it's not there, you're not reasonable, you're wrong. You probably feel frustrated too. You probably become a little bit defensive. You might even stop listening to people who keep challenging your reality. That's often what our loved ones experience. And again, that doesn't mean their beliefs are correct, right? But understanding their perspective can help us communicate with them more effectively. And I've told you this about my daughter. We argued with her for weeks, for months. Her imaginary prince named Friedrich He wasn't there. How can you say that? There's nobody in that chair next to you. Come to your senses, whatever. And she would get emotional. And one day, and again, not sure if this helps, one day I just looked and I said, on the scope of life and things, having an imaginary friend, so what? Why do I have to argue my way through it? And really what helped us was we just accepted it. Okay, well, that's who you see, that's your reality. Wonderful. And you know what? It may have looked a little odd if you came into our house at dinner time and saw us setting a place for a person who didn't exist. It didn't hurt anything. And you know what happened? Slowly, it took months, but slowly he didn't exist anymore. She stopped talking to him. The hallucination went away. And you know what? It it didn't hurt us at all. So there's that. I'm just throwing that out there as a personal experience. So a lot of people say, well, how do we deal with this? What's a good way to approach this? And kind of my example, I kind of put into practice what I'm going to advocate next. And some of you may have heard of Dr. Xavier Amador. He actually uh, developed this approach. He calls it the LEAP approach, LEAP, for listen, empathize, agree, and partner. So instead of arguing about whether someone is sick, we focus on understanding their experience, like I just demonstrated. Empathize with it, listen to her, agree, partner with her, right? And that's instead of saying, right? Instead of looking at him saying, you need medication because you have schizophrenia, right? We might say, and again, this is where the empathy kind of comes into play. It sounds like you're having a really difficult time sleeping. What do you think might help? Notice the difference. We're not debating, we're building trust. And often trust opens doors that arguments never will. I don't have time to go through the entire LEAP approach. I give that to you. Go on Amazon. His book is out there. There are even workshops, the live workshops that they do around here. I know here in Utah, they did some recently that you can sign up for and pay for and actually be trained in the LEAP approach if that's what you'd like to do. Highly recommend it. I've heard from a lot of people that this just made a transformative difference in how they communicated with their mentally ill loved one. So I don't often advocate treatment. I'm not a psychiatrist, but this is one that I can actually, I have used it and I do use it, and I would highly recommend it. So finally, if you're a caregiver and you're caring for somebody who has this anosognosia, I want you to hear this. You're facing one of the most difficult challenges in mental health caregiving. You may feel exhausted. You may feel defeated. You may feel like you just don't want to move on. You may feel like you're talking to a wall. Sometimes you may wonder if anything you're doing really, really matters. But understanding anosognosia, understanding arguments aren't going to work, that they're not just denying it, it's not made up. It's a genuine illness. Helps you to understand it and can reduce some of that anger and confusion that you're dealing with. Because instead of seeing your loved one as refusing to acknowledge reality, you begin to realize or recognize that they might be experiencing a symptom of the illness itself. Denial isn't an illness. Anosognosia is an illness. Now, that doesn't solve the problem, but it definitely changes how we respond to it. And often that's where progress begins. So, closing, again, like and subscribe. But in closing, there's one thing I hope you take away from this video, and it's this. When a loved one says, I'm not sick, they may not be lying. They may truly see it that way. They may not be in denial. Denial is a whole different thing. They may be experiencing a neurological symptom called anosognosia. Now, understanding that distinction can transform the way we communicate, the way we build trust, and the way we support the people who we love. If you've dealt with anosognosia in your own family, I'd love to hear about your experience. Leave a comment or send an email to me directly. I would love to hear from you. I'd love to hear your comments and experiences about this. Your story may help another caregiver feel a little less alone. And if you found this video helpful, again, like, subscribe, give me suggestions for topics in the future, things that you may be dealing with. I don't know everything, but I've experienced a lot. 14 years dealing with mental illness, doing workshops with NAMI, and again, running my nonprofit. I've got quite a bit of experience with it. So my best to you, my heart goes out to you. We're in this together, and hopefully this has helped you see things from a little different perspective. Thanks a lot. Look forward to seeing you in the next video. Thanks for watching.